Jacinta's influence extends across all scopes of practice within the pharmacy profession. Her research has gained international attention. She is an inspirational lecturer within the University of South Australia's School of Pharmacy and Medical Sciences, and she is noted for her passionate support for early career pharmacists, interns and students Australia-wide.
I'm really glad that I chose pharmacy as a career because it has always provided new challenges when I wanted them. It's always given me different opportunities. So when I first went into pharmacy, I thought that I was going to run my own little pharmacy, and that's probably the furthest from what I've actually ended up doing. I went through my undergrad year at UniSA and I did honours in my final year of the program. I did my intern year at Flinders Medical Centre, and then I did a PhD based at the University of Adelaide in their pharmacology department. And while I was doing that, I started teaching. In amongst that, I was working in community pharmacy and with drug and alcohol services. And then as I wrapped up my PhD, I went back into hospital pharmacy. In the hospital, I work in a lot more sort of project-based roles. So I really like that, taking a step back and having a look at what you've created. I really like the chance to work on projects that have an impact beyond just the one individual patient, where they have sort of flow-on effects for patients across a broader spectrum. I'm quite proud of codeine research. So we did some work that showed for the first time that codeine, when it's used in a chronic sense, can actually increase pain sensitivity. And a lot of that work was lab-based. So you're sort of there doing your PhD, working away in your lab thinking, is this ever going to change anything? It's only the first step. And then recently I did a presentation with a drug and alcohol specialist and a pain specialist. And that pain specialist, he said that he was using my paper to educate other doctors around using codeine. So I guess that was really rewarding, seeing those basic level concepts actually impacting on clinical decisions being made. I think probably my passion is around teaching, but that doesn't just mean in the formal tertiary education setting. So even within the hospital, I'm involved in a lot of practitioner development. I've found it rewarding to see the impact I have on other health professionals and young pharmacists coming through, and seeing the way that I might be able to help shape their practice and the way they interact with patients.
A future leader of the profession, she is generous with her time, knowledge and consideration, and is a worthy recipient of the 2018 Early Career Pharmacist Award. Congratulations, Jacinta Johnson.